Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. With the closing of Steward Healthcare's Neshoba Valley Medical Center, it's caused a major crisis here in north central Massachusetts. This week we're going to be talking to you about if you're a pain management patient, you're going to have treatment options here at Maragal Medical. And this week Dr. Marciello is going to talk to you about our unique approach to pain management. A lot of great information coming your way, so stay tuned. Okay, Dr. Mike, big deal. All over the news this summer was Steward Healthcare. And actually, I didn't even realize that Neshoba Valley Medical Center was a part of Steward Healthcare. They've been established for, many decades now. A great community hospital. We treat a lot of patients from there, particularly from their pain management center. A lot of patient referrals. I know in the past I've had a chance to speak with Dr. Fino. There's going to be a major shortage of providers that can care for these patients, but when it comes to pain management, we have a solution for those patients, but our approach is a little bit different.
It is, and it really is, as to your point, rather shameful and kind of sad to think that central Massachusetts is now going to have more difficulty getting patients into, seeing their doctors and getting good care. And in relation to the concept of how we could be different and add to that benefit of people to get their treatment that's needed, is we look at it from more of a holistic aspects of things, not just the traditional ways of saying, hey, you've got this problem in your shoulder, you got a backache, let's just get you on some medications, let's send you to therapy or give you some injections. We really think about comprehensive ways of thinking a little outside the box. Food as medicine, as we think about it, thinking about anti-inflammatory diet programs, thinking about soft tissue, trigger point injections, and myofascial management, which looks at the little bits and pieces of how our body moves. The chiropractic services that we can provide in combination with physical medicine services, and putting those things together really starts from a point of movement and body and posture and all those things first. Then we think about medications. Then we think about, getting into some other treatments such as injections. We certainly can put together the MRI pictures, the x-rays, the things that we're going to need for diagnostic treatments, but we want to get that person on track from a point of now, today, next week, and the long term.
Right.
We don't just think about only, let's throw some medicine at it and see if we can get you off feeling better for a week.
Yeah, and the advantage at a private medical clinic like ours, we have the time to spend with the patient so that we can identify the root cause of the patient's problem. It's no good if you're just simply prescribing a medication for a patient but not addressing the root cause of the problem. And what's convenient for a lot of patients is we have all of those services under one roof: the medical care, the physical therapy, and the chiropractic treatment. And then we use cutting-edge treatment options like regenerative medicine that not only helps with pain relief, but also helps to repair some of the damage to that tissue as well. So definitely a lot of great treatment options for those patients.
No question, and we think about the musculoskeletal body, guys, is the primary source of pain issues, right? We all, somewhere around 80 to 85% of people throughout their life will have back pain.
Yeah.
And so we know musculoskeletal joint pains come into play for all of us in some way or another. And we start thinking about using our own body's reparative properties to get them better. We can use platelet-rich plasma injections, these regenerative injections, as well as getting them on a health maintenance program to think about their lifestyle. We really think about that as important to think, if you're losing weight and exercising and eating healthy, as well as doing these other good treatments such as movements, that person's going to be in the better track, certainly for the longer term. And that's what we always think about. We want you better for the long term, not just for the short term only.
Yeah, that's great, folks. If you're a patient of Neshoba Valley Medical Center and now you find yourself at a loss for treatment, you definitely want to give our office a call. There's a lot of great information on our website, maragalmedical.com, and a lot of great patient education videos on our YouTube channel. Please consider subscribing there. Well, that's it for today. I hope you learned something. I hope you're now confident that you have additional treatment options for pain management here in central Massachusetts. Have a great day, everyone.
Take care.